There's two of you there. You're sitting right next to each other too. Thank you all for being here this evening. One of the big things that we ask of you as part of your care here is to educate yourself on how to take care of yourself. One of the biggest things here is I try to explain to people these aren't pep rallies for chiropractic. They're not. Oh, okay, you must do this, or or it's not going to work. What they are is information for you to take from here that you may have heard before. Okay, my hope is that you will get one nugget of information that you can take out of here, and you can take an action step and use it for yourself. One of the biggest things is people come in, they try to do the same thing, and they do it again and again and again, and what ends up happening is they expect different results. And the whole process here, some of you have made some major life changes. Some of you have had to wait until something happened to have changes in your life. Some of you have had aches and pains, not anything terminal or anything of that nature, that have made that has brought you here to this office. So I welcome you here. I thank you here. We look to spend only 30 minutes here. I value your time, much as I value my time to be able to go home and spend with my children. The Dr. Mike, who has been helping me over these past several weeks, has a practice out in Dover, and he has been here. We are an educational facility, so he's a doctor that's learning how to go through the actual procedures, not the adjusting. He's an amazing adjuster. He adjusts me. And one of the things was I was like, well, come on in on Tuesdays, and he's helping me so I can get these things prepared for you and make sure that you're getting the information that you need. This is the first time I'm doing this workshop. This is called Strokes Uncovered. Many of you know what you need to do to help avoid strokes and have heard it before. And I will go over that at the end in a little bit of detail. But if you want a lot of detail, I advise you to start taking a look at the nutritional workshops and some of the exercise workshops and things that we do here. This particular workshop is for you to understand where the risk factors are, okay? What those risk factors are. And if I was to ask with a raise of hands, has anybody here known somebody that's had a stroke? Yeah, almost everybody here, probably 90-95% of the people that are here. So that's, there's risk factors involved with it. What are some of the risk factors that some of you have heard about? And
Hypertension.
Hypertension, or high blood pressure, yes. Anything else?
Diabetes.
Diabetes, okay. Guess what she does? So she's an EMT, so right, EMT, right? So one of the things where, and those are two of the big ones. One of the things that we have to understand, and I'm going to read some numbers and facts from a sheet of paper because I want to make sure I give you the proper information. Strokes are actually number 4, the number 4 leading cause of death after medicine. Okay, so medicine is actually 3rd on the list. Iatrogenic causes, things of that nature. So that accounts for about 285,000 deaths per year. Coronary vascular disease or heart issues include about 10% of those problems that go on with that, and they're saying that about 40% of the U.S. adults by the year 2030 will have some sort of cardiovascular disease. That's a scary number, because do you realize that the generation of children that are growing up now, okay, they are predicting they won't live as long as we will. There's something wrong with that. Okay, there's something wrong with that. So we have to look to causes of those things. So, and then, cardiovascular disease actually is responsible for about 17% of the national health expenditures, and one of the leading causes of death, as we spoke about. So, ultimately, what are we looking at here with this workshop? We want to have. Ooh, I have to turn it on. Sorry. I was ready, but I didn't turn it on. Shared decision making. Okay? This is not something that I can tell you. This is a decision that we make together. Much like you decide to be under care, much like you decide. These are things that you have to decide to change or do. Okay? So this is one of the things, but all I can do is give you the information. So my job is to provide facts and educate individuals that are interested. You are on that higher echelon of people. You're here. Okay? A lot of people could care less. Okay? And that's part of the problem. Let the research speak for itself. I'll go a little bit into research. I try not, you'll see a lot of it up there. I might not relate to it right away, but if you really want to sit down and talk about the research and want copies of things, and let me know, because then we can have a discussion. One of the powers of being here is that once we're done in 30 minutes, I shut off the Facebook, and then if you have any questions for me, I will sit around and answer some of the questions. If not, you're free to go. Okay, so those are the things that we look at. Acknowledge the patient's autonomy. This is an important aspect of everything we do. One of the challenges with the medical paradigm of thought is they say that they're giving the patient the autonomy to make the choices or decisions, but in reality, if you don't abide by what they ask you to do, they say they can't take care of you. And some of you know that better than others because you're not following exactly what they want you to do or what medically they want you to do. And there's a time and place. I mean, absolutely, those individuals are educated, but you should be, there's two questions I always ask people when they go to the doctor and if they get a medication or there's a surgery is, why are they doing it? Or why are they giving the medication? Is there a study that backs what they're saying? Okay, and also, also, can you get a copy of it? Because I'd like to read it. Because those are big things. Because it's an important aspect to what we do. You need to have that knowledge, and above else, do no harm. I mean, that's the Hippocratic oath is do no harm. So that's an important thing. So one of the things that you mentioned, okay, high blood pressure, okay. We have to make sure we understand the difference between causality and association, okay? Because when you have something that causes something, it is a direct cause, it's direct, okay? They look at this, and this is what happens. So there's a word, pathognomonic, that some might know, some might not know. What it means is that if you do a certain thing medically for a physical, for somebody, if you do something medically, they can absolutely diagnose something. Okay, so for example, if they give you nitroglycerin and you have angina or heart, you have chest pain, they diagnose you with angina because it's pathognomonic for that, because it gets rid of the discomfort. Okay, so there's certain things that are actual, specifics. So high blood pressure was the first one that we were talking about. It's interesting that high blood pressure, what do they do for high blood pressure? What do they usually do for high blood pressure? Medication, right? So did anybody say anything other than medication? No, okay. So let's, go ahead.
Learning other behaviors.
Right, so, and trying to learn other behaviors, lifestyle factors. They do start to address that now. Okay, they didn't before. As a matter of fact, someone that's had a heart attack has to go to like 3 months of rehab right away, and you're supposed to learn how to do things and take care of yourself. It's interesting, but the interesting fact about medications, this comes out of the Science Daily. The source was the University of Alabama at Birmingham. The summary says the importance of preventing hypertension is reinforced by studying show anti-hypertension medicines can increase stroke risk by 248%. So, reading further into the study, Howard, the doctor's name is Howard, says the risk of stroke went up 33% with each blood pressure medicine required to treat blood pressure to get to a certain goal. Okay, there's a certain goal that they want to get your blood pressure down to, like 140 over 90 or whatever it may be. Compared to people with systolic blood pressure below 120, which is the higher of the two numbers, without treatment. Hypertensive individuals on 3 or more blood pressure medications had a stroke risk of 2.5 times higher. So not only is the blood pressure a risk, now the treatment that they're giving you could possibly be a risk. This stuff people don't know. But yet they say, oh yeah, but it's successful, lowering the blood pressure. The thing is, as we get older, naturally, our blood pressure goes up. Why? Hardening of the arteries. Because they're not as pliable. Okay? But did you know that, well, I'll get into it. I'll talk to you about the pliability of the arteries and everything.
Does the group here understand the difference between the two types of hypertension, the systolic or the diastolic one?
Well, that's something that is much more enveloped in this. So it's much more beyond this class. I'm just giving you the basics.
Okay.
Okay. So there is a difference. The systolic, diastolic. We're talking about the higher number that they were looking at. Okay. And she is correct. There is a huge number with the diastolic, but I'm just trying to give you the basic information. And if there's more, absolutely, we can talk about it afterwards. Okay. Atherosclerosis, which is hardening of the arteries. Diabetes. And they actually say hardening of the arteries isn't necessarily a bad thing, which is interesting to find out later on. And trauma. So trauma is obviously, you can't, you have an accident and, something happens, you can have a stroke. I mean, that's just related, in the indigenous societies, their traumas were getting, bored by an animal or, or attacked or something like that. Yeah, stroke is possible when stuff like that happens. So that's an important aspect of something that's going on. So what is a stroke? A stroke, there are two basic types: ischemic and hemorrhagic. Okay, a rapid loss of brain function due to disturbance in blood supply to the brain. It can cause permanent tissue damage and parts of the body to not function properly. So, what's classically what people see when someone has a stroke? They get hemiparalysis or hemiparesis, right? So they get, okay, that's usually a hemorrhagic stroke. And that's usually the classic one that people know about. The thing that's interesting is 80% of the strokes are actually ischemic. That's the interesting. Most people relate to this one because that's the one they know about. That's bleeding. That's hemorrhagic. There's something going on. So, for example, individuals that take a lot of aspirin or blood thinner type stuff have more tendency to bleed, and they can get petechia or pinprick type bleeding, and that can actually that might increase the risk of stroke. So you have to be aware of these things. So ischemic strokes or ischemic strokes are usually caused by some sort of clotting type of mechanism. Okay. So what happens here? So let me read this to you. They're caused by an interruption of the blood supply, usually due to blood clots or fatty deposits called plaque in blood vessel linings. Over 80% of all strokes are ischemic. Ischemic strokes are caused by expanding hematoma in the lining of the blood vessels, resulting in stenosis of artery and tissue damage. So what does that mean? That means there's some sort of blood tumor. It's not really a tumor, but something growing in there, and then it causes a narrowing of the vessel, and that's what happens, and so it stops the blood supply. Did you realize that 3/4 of the people that have so-called transient ischemic attacks or transient or ischemic type strokes have good recovery rates? 75% of them have good recovery rates. There's no residuals on it because it's a transient thing. It just happens and it goes on. Unfortunately, about 1/20 of them, they have really bad results, resulting in death or close to death type things. So those are the things that you have to understand. So why is this? Why are we so interested in these things about stroke? In a minute, I'll explain to you why. This is what happens. This is just a picture showing you of the clot formation and how it may interrupt the blood flow. It just gives you a visual understanding of it. Okay? Because people have to understand that. What really happens? That's what happens. Vertebral artery dissection. Has anybody ever heard of that? You probably have. That means that the artery in the vertebra, vertebral artery, which is up in the neck, has been cut. Okay, that's basically, it's dissection. Dissection, it means it's cut. Okay, that is part of considered an ischemic stroke, and it's interesting because just because you have a clot or you have some sort of trauma does not mean that those strokes are going to occur. Okay, that sometimes they can occur. And we already talked about the possible neurological problems that can come about from all of those things. So we talked about how it can affect speech, the way you smile, the way you move your arms and legs. And there are people that have, but those are the ones that really get damaged in most cases are the ones that have the bleeding type. Okay, but 80% of the strokes that are out there are ischemic, so you have to know that there's preventative mechanisms for it. Usually it comes from and I'm just putting these numbers up there so I can talk about it to you guys. So vertebral artery dissection is a big one. Let's put these numbers into our population. 100,000 people in the U.S. on average will have a vertebral. One in 100,000 people will have some sort of ischemic type stroke. Okay, in our country. If you think about it, I'm not using the exact number. I'm just trying to round it to make it easier. We have about 300 million people in our country. Right? So if you take the numbers and you look at the number of strokes and 100,000 people, about 3,000 of these are caused annually by specific vertebral artery dissections. The other 97,000 are usually a clot. Do you get the difference in the numbers? 3,000 are from particular vertebral artery dissection, from something, either a trauma or something happening to the area. The interesting factor is this. 10 to 25% of ischemic strokes are due to vertebral artery dissection or some sort of coronary artery disease under 45 years of age. When they get above, the numbers flip-flop. The numbers don't flip-flop. They actually are better for older people. They don't have as many of the vertebral artery dissections. That's where the plaquing comes in. Because they're saying it's not as pliable, that it's harder to break the artery. So because of that. So the thing is, yes, our body naturally hardens the arteries as we get older, and our pressure will go up a little bit because of that. But in essence, it's actually protecting it from actually breaking. So it's kind of interesting that our body, it's just that we overload it with things that actually plaque it a lot. Okay, so those are the things that we're talking about. And 40% of this 87% is caused from unknown causes and major traumas. So the big thing here is this here has become a big factor in what I do as a chiropractor, because there is a lot of stuff out there talking about, and I have spoken to medical doctors about this, and I've talked to them. They say, oh no, don't go get adjusted, or you might have. I've seen people that have had damage because of adjustments and stuff. But the thing is, it's interesting because there's an association, but there's no causal link. What they're doing is they're looking at it over a few days, and they're saying, and the risk factor of someone having vertebral artery dissection, okay, being 3,000, okay, 3,000 vertebral artery dissections, okay. If you look at 1 out of 200 people walking, there's about 60,000 chiropractors in the country. One out of every 200 people that walk into my room, someone may have a stroke, but it has nothing to do with them being here. So the thing is, you have to think about these numbers, and I'm going to go over some numbers on showing that there's very, very low risk in being adjusted. Okay, because the highest risk factors are really the lifestyle factors that we were talking about. Okay, because if we can prevent these things, these are the things that we're looking at. So what are VA vertebral artery dissection strokes associated with? Look at all these things that are up here. Judo, yoga, ceiling painting. Why ceiling painting? Nose blowing. Okay, because you can actually bring something, hypertension, which we talked about, oral contraceptive use. Okay, why is oral contraceptive use? Can form clots. Oral contraceptives are more prone to clots or thrombi. Sexual activity in itself, receiving anesthesia, use of resuscitation activities, receiving a shampoo at the hair salon, vomiting, sneezing, adjustable manipulative procedures. So yeah, we're in there. But all of this stuff is associated with it. You can't deny. I mean, it's there. But the thing is, all of a sudden, people start saying, "Oh my God, I'm going to go and something's going to happen. Don't touch my neck. Don't do this. Don't do that." And you know what? I have respect for those people, but they don't know the numbers. They don't know. They don't know the factors that anything that they're doing, can possibly cause the stroke. And majority of the time, when people have a stroke and they do any one of these things, and they have the stroke, that dissection was already there when they walked into the place, because the body was already prepared. It was like, okay, something's wrong, and we're doing something. So it's important to understand that the risk factors, the association is there, but the true risk factors are not these things. Okay, because you could be working out and have a stroke. Okay, so those are the things that we'll look at. So there was a study. This comes from the journal Spine. The journal Spine has one of the highest ratings. It's like one of the hardest journals to get into. It's one of the hardest. It's like they have a rating of, I think, a scale of 5, and it's like up close to 4. It's really hard to get into. Risk of vertebral-basilar stroke and chiropractic care. They actually looked at this because people were starting to worry about it. Okay? So assessing your significant risk. So this is an interesting thing that we'll look at in a second. I just want to read. The study, which analyzed 9 years' worth of data from a population of 110 million persons, concluded that vertebral basal artery stroke is a very rare event, and that the risk of a vertebral basilar artery stroke following a visit to a chiropractor's office appears to be no different than the risk of a vertebral basilar artery stroke following a visit to the office of a primary care medical physician. And the study goes on to say less risk of getting a stroke after chiropractic care than medical care. This comes right out of that study. So this is an important thing, because you can go into, I mean, how many people go in with headache and neck pain? Does it mean you're going to have a stroke? No. But you're just as likely to have one, based on that study, or more likely to have one going to your medical doctor than you are going to a chiropractor. But God forbid something happens, then you have to take care of it. And I get it. But the thing is, there is no, someone comes in with, how many of you have ever had a headache or neck pain? Did you ever think that you were going to go in and have a stroke? No. I mean, let's be realistic. No one thinks that they're going to, I mean, if it happens, how do you assess for that? Someone comes in and says they have headache and neck pain. You really can't assess for something like, and 1 in every 200 people that walks through my door could possibly be having a stroke before they even get here. So the thing is, you have to understand that these are the risks that we look at. Again, this comes from the same article. So these are some of these studies done dating back from 81 to 2001. 1 in a million adjustments, 1 in 2 million adjustments, 1 in 5.85 million cervical adjustments. We can go into a lot of talk about this, but this is just so you understand that the risks are very small. The risks are very small. So, who's the at-risk population? Have you ever heard of the, ooh, go back. Smokers, right? Everybody knows smokers are, I mean, my dad smoked till the day died. God bless him, I don't know how he lived to 82 years of age. Okay, I have no idea. He was a reformed alcoholic, stopped drinking when he was 54, never drank another day in his life. All he drank was coffee, and he smoked cigarettes, and he lived to 82. God bless him. He did have adenocarcinoma. He did have a cancer in his kidney, but it's like, I don't get it. I just didn't get it. But some people have that type of constitution. So smokers are very at high risk. Heart disease, high blood pressure, we talked a little bit about that. Collagen disorders, anybody that has a specific collagen disorder, there's some of them like Ehlers-Danlos syndrome, Marfan syndrome. There's certain genetic disorders that tend towards that. Okay, so you have to be aware of that. And people recently in motor vehicle accidents. Why? Or people that have recently had surgery. Why? Trauma, but what does trauma cause? Clots. She knows. She sees it all the time. But clots are formed. They always are worried about clots. Always, always, always. Okay, so that's the big thing that we're looking at. So inform people who take appropriate actions are less at risk. It is important to treat the underlying cause of a stroke. At least 1 in 8 stroke survivors has another stroke within 5 years. Journal of Cardiovascular Risk. Is it because they didn't change their lifestyle or they waited till it's too late? Don't wait till it's too late. Change now. You can change the things now for the future. If you wait till it becomes a problem, then it's too late. Okay? But you can live a healthier life for whatever time there is there. So actions you can take, get your nervous system checked. That's what you do here. Okay, and that sits at the top of the priority list. More exercise. This is a big one because it is hard for some people to just get up off their bum and do something. Okay, and going to work every day and being physical is a great thing, which I do, but you still have to do some sort of activity that is going to stress your body or push your body to a different limit. Okay, does it mean you have to do this really, really, really strenuous stuff? No, but you should try to do 30 minutes a day. Doesn't mean you have to do 30 minutes in a row. If you want to get it all done in 30 minutes and go on your way, great. But you could do 10 minutes in the morning, 10 minutes at lunch, 10 minutes in the evening. Or you could do 5-minute breaks, I mean, something to get your heart rate running, doing something, okay, that'll keep you moving, okay? You can break it down and do it. Doing it 30 minutes in a row is good, okay? However, there is a study out there that shows that you can do 3 minutes of high-intensity workout. And we're talking really high intensity where like you're gasping for air, feeling like you're going to throw up for 3 minutes, and it's just as efficient as doing 30 minutes. If you want to go that route, great. Me, I like the 30 minutes and doing the bicycle and getting on there and pushing myself for a couple of minutes and then relaxing. Pushing myself for a couple of minutes and then relaxing. Okay, so the thing is, you need to get up and do something. And they actually did studies showing that if you just add 30 minutes of exercise, it's better psychologically, it's better for your brain function. We do a whole workshop on that too. Better diet. Diet is one of those things that I get a lot of people, okay? I get a lot of people that say, oh, I eat well, I eat healthy, okay? I can change things, I can just change my diet, I'll be okay. Great. Is that diet specific to you? Because they're trying specific diets, they're trying all these different things. Everybody's blood chemistry is different. Everybody's way they respond to certain foods, whether it be carbohydrates, proteins. You need to have specifics. You need to know what's going on in there and how to address them. How can you speed up metabolism? How can you not? You can learn the basics, but better diet does not just mean cutting out gluten. Ooh, it's 7 o'clock, I'm almost done. That's my reminder, you realize. So these are really important. And then reduce your stress. That's probably, now that people aren't around holiday season, they have different stresses. taxes, paying off the bills from holiday season, you know, all this other stuff. But ultimately, we have a couple of workshops that we do on stress. That's why we have two, to help you learn how to handle certain things. But ultimately, the simple things, you know, getting checked here is a great thing. Okay, doesn't mean you have to. Okay, but what you're doing is you're trying to prevent the problems from happening. Okay, more exercise. You can have a very physical job, and it's tiring at the end of the day, and I get it. So don't wait till the end of the day. Get up in the morning. And people are like, I don't want to get up. Okay, I get it. All right, but the thing is, you have to do something. Okay, if you want to change it, you have to do something. Eating well, talk to me. My background is in nutrition. Okay, we'll sit down and we'll figure out something, see what you're eating and see what's inflammatory, what's not, what medications you're taking. We'll try to figure out a way to help your body function at a higher level. Okay, and then reducing stress. You're doing it by getting adjusted. You're reducing the physical stresses. Now you have to work on the mental aspect of it. Okay, and that's just taking 3 deep breaths. I always have people do that, and it just relaxes the body and changes the functionality of the body. Simple things. People you know need to know this stuff. They do. They need to know that, yeah, I've heard this before. Okay, so what are you doing about it? That's my call to action. Because if you've heard this stuff before, why aren't you doing something about it? And you guys are. But what about the people you love and care about? That's really important. And you know, I tell you, I'm going down, next Tuesday I'll be or actually Monday and Tuesday I'll be teaching at a chiropractic school. I do it not because I want to be recognized. Yes, come in.
Nice.
Hi. Not because I want to be recognized, but because I want to help kids understand that this is an important aspect of life. I thank you very much for being here. You guys have a great evening. And you just came in. Were you expecting it to start at 7 or?
7, yes.
It was supposed to start at 6:30. It starts at 6:30, and we just finished. But I'll give you an option. Thank you all for being here. I appreciate it.